That sounds like a big number. I brought them with me. Excuse me. Here they all are. Those are the 2,100 mandates placed on health insurance policies in this country. And they're not all medically necessary. For instance, Illinois, infertility, hair plugs, health club memberships. Why are we paying for things that we should not have to pay for? They're not medically necessary. I don't have the right plumbing below my navel to have a baby. But I've got to pay for infertility because I live in Illinois. That is not medically necessary. Last, Medicare. Politicians don't want to touch the third rail of politics, which is Medicare. Guess what? I'm not a politician. So I'm going to step all over it today. The Democrats, including Joe's opponent, Tammy Duckworth, like to say the Republicans are going to change Medicare as we know it. Let me tell you something. Medicare's already been changed as we know it. In fact, Medicare was destroyed with Obamacare. You remember Representative Paul Ryan saying that $569 billion was taken from Medicare, right? I would like you to replace the $569 billion number with $4.95 trillion. Because according to the chief Medicare actuary of Medicare, Richard Foster, his assessment, Obamacare will decimate Medicare. Over the first 20 years, it will cut $4.95 trillion from Medicare. And worse than that, it will reduce the reimbursement ratio that the government pays to doctors who still take Medicaid. Because in Illinois, they don't. A lot of them don't take it anymore because they've been paid for 2 years. But those who still do, those who take Medicare, will now be given less reimbursement from the government than doctors who still take Medicaid. You know, the ones who like to work for free. What does that mean? 2 studies you'll never hear about, except for right here. University of Virginia, 2005. They did a study to find out people on Medicaid, what is their survival ratio when they have surgery on Medicaid compared to a patient who has surgery with private health insurance. 50% more likely to die after that surgery. Why? Why? Because the doctors aren't being paid, so you're not going to get follow-up care. Fast forward, last thing I'll say, Joe?
No, you're fine.
Fast forward, 2009, University of Virginia. As soon as that study came out, government, oh, we got to fix it. You get 50% more people likely to die in surgery on Medicaid. Here's what we'll do. We'll put more big government on that and get it fixed. 2009, fast forward, University of Virginia. Guess what the likelihood is, percentage-wise, when you have surgery on Medicaid, to die now compared to people with private health insurance? Can someone say 97%? Now, when you fly, we just found out what from the CBO and from Mitch McConnell's report, 25 million more Americans will be shoved and auto-enrolled onto Medicaid because Obamacare raises the eligibility for Medicaid 400% higher than existing. So a family of 4 can get on there making $90,000 a year. And they get half their health insurance paid for by the few, the proud, the 53% who pay taxes in this country. So you shove 25 million people onto an already bankrupt Medicaid system. What did Sarah Palin say? That's all I have.
Hey folks, what I'm going to do is I'm going to put our 2 dots and our insurance expert up here. Let's open this up to Q&A because now I want to hear from you guys. Hold on one sec. I'll come to you first. Hey, our illustrious panel. I'm gonna be the game show host here. I'm gonna have a firm hand. Do your best to keep your questions brief. Brief. Do your best to keep your answers brief. I want to hear from as many folks as possible. I'm doing this for a very important reason. It's not a selfish reason. I'm telling you guys, there is not a more important issue in this election than this. Let's hear from as many people as we can. Start us.
Yes, George Bush's unfunded drug plan. This plan pays a minimum of 400% more for drugs than say what the VA pays for their drugs. Most drugs are made outside the United States, but it's illegal to import drugs from Canada. I'd love to know why you aren't going against the George Bush unfunded drug program.
What do you say? Anybody want to weigh in on this issue?
It's a disaster. Okay? The difference between,
He's good. He's got a plan.
the difference between the Republican Party, most of them, excluding this one, and the Democrat Party is that the Republican Party just wants to control spending their way. A lot of them don't have a problem with cutting spending. A lot of them pass massive entitlement programs like Medicare Part D that was unfunded from the beginning. Never had any money in the first place to fund it. Now it is even more bankrupt. So I don't know where Joe stands on it. I'm vehemently against Medicare Part D because it was an unfunded liability. Our unfunded liabilities in this country are at $65 trillion. Between Social Security, which FDR promised would be put in a, quote, lockbox, and was robbed for every other expenditure. Medicare, Medicaid, and now you put Part D on top of it. It's not just the Democrats that spend deficit spending recklessly without accountability. It is also many members of the Republican Party.
Rich, Dennis, anybody want to weigh
I'm a
in
little
on
more
this?
pragmatic. I make the drugs cheaper, and you do that by reducing liability. You gotta understand, without our medicines, we're witch doctors. Okay, we need those guys to do research and development to have new drugs, but make it cheaper. Get the lawyers off our backs.
There was just a law recently passed where generic drugs sold in the United States, there's no tort. I mean, that you cannot sue someone if you get something happens to you with generic drugs. Could you comment on that?
Well, again, as long as there's government oversight to check this. Years ago, there was a company making immunizations like tetanus and the flu shot, and they were getting sued so much, they said, we're going out of business. The government said, wait a minute. So they upped the price of the medicine. They put that money into a fund in case you get a bad reaction. You don't sue, you get the money out of that fund. Unfortunately, you still need a lawyer to get that money. I don't understand why. Again,
well, comment on generic drugs. Why aren't they being
Briefly.
why aren't they what?
Why can't you sue a company and say if it's made in India or something and it's a defective drug, you can't sue it if it's a generic drug? And that's a recent law. You should know about that.
That's I just recently heard about that, but again, I'm not a lawyer, so I can't.
Let's hop around. Yes, sir.
I might be over my balance here, but
Then you're in a good place.
yes, I am. What I've heard is starting January 1st, 2013, any monies that are deposited into a bank or withdrawn from a bank, 1% of those funds are being taxed to the government with the guys for health care and some other things. What's going on here? I never told anybody to take out 1% of my funds every time I touch it.
Let me answer this because this is political. There's a reason why less and less people now support Obamacare than when it was passed. And when it was passed, the American people didn't support it. Every single week, we've learned something bad that's in that bill, the 2,000 some pages. Again, it's always so easy to make fun of what Nancy Pelosi said. Politicians on both sides of the aisle do this. They pass these big things and they don't know what's in it. There were a lot of things that were put into Obamacare purely to raise money. We repealed one of them last year, the 1099 thing, charging you $600 every time you have to fill out a paperwork for a 1099. That's another one, 1% on any bank transaction. We've all heard about the 3% on any real estate transaction that will kick in sometime soon. There are revenue raisers in this bill that most politicians didn't know were in there. And they have nothing to do with health care. They're only put in there to raise money, to raise tax money. Now, I'll tell you this, though. I think we got to repeal the whole thing, or I think we're sunk. But every time we find one of these really embarrassing things in this bill, even many Democrats join us and say, oh, we got to get rid of that. I mean, we repealed the Class Act, the long-term care piece of Obamacare, because even the Obama administration admitted it's not sustainable. There's more where that came from. Yes, sir.
Brief statement and question. The statement follows as follows. The successful abortion program of our government has killed enough children that would already more than pay for all of this Social Security and the rest of it infinitum, provided there were jobs available. End of that statement.
Your question.
The question is, Obamacare is already taking place here, and certain pieces of it are ready. You may not be aware of it. My wife runs a major medical office, but they're now asking for your Social Security number and other information when you come in as a patient. That's illegal, and they're steering this stuff to where it's going to be fed straight to via the EMR, the Electronic Medical Records Program.
Any comment, Docs, Dennis?
That's absolutely correct. In fact, you know, we as private medical practices were effectively forced to go EMR, electronic medical record. And don't get me wrong, it does make our lives easier. It makes it easier to interact with patients, and it does save some money. But what they're effectively going to use it for is to track you. And if you're a Medicare patient and you're receiving funds from the government, they will know what you're doing, what you're not doing, and you know, like I said before, we're all smart people, that the government will use that information, and that is correct.
Yes, ma'am. Stand up and be loud.
You just mentioned, you know, when you were talking about that, okay, so being prepared, what are people supposed to do?
What are people supposed to do?
Basically tell them go away, I'm not going to give you my
Vote.
information.
Wow. Okay, hold on though. That's a great answer. Obviously, this is it, get involved politically, but as a patient moving forward, how are patients supposed to be reacting in this new world where the government's trying to get at their information?
Right.
That's a wonderful.
As a single practitioner, I can pretty much tell the government to go so far at this point, because I'm so small, as much as they've hassled me.
Sure.
I'm too small for them to really take a whole lot of time and really pester me. But I've had requests for records, and you know, we get the requests all the time to go electronic, and it's like, no, we're not doing it. We don't have to. But the point is that when the patient comes in the door, I want to be able to say to that patient, look, you don't have to provide this information, not only here, but anywhere else.
Can you do that now?
It's great that you're saying that, because I had the same conversation, almost the same statement that you're saying with a group of friends who are also physicians. I said, my God, I'm not going to do this. You know, and I started talking to my patient. I think this meeting was Tuesday, and by Wednesday, Thursdays in my clinics, I see 200 people a week in clinic alone, and at least 15 to 20 people in the hospital every day. I see a lot of people, and I'm thinking, my God, how do I let people know? And you know what I've opted to do is we're putting together a letter, and we're saying, look, we're not being forced, but we're being wink encouraged, nudged to provide this information. And I would provide the phone number for the local Congress people for the patients to call and complain.
What's your practice?
Audiology.
Obamacare, be succinct. What's your biggest fear?
Cuts in the Medicare reimbursement.
Cuts in Medicare reimbursement.
She's already stopped taking most Medicaid.
You've already stopped taking most?
Medicaid.
And is that fairly common, guys?
For the hearing aids.
You don't take Medicaid?
No, neither do I.
Well, for the sheer reason that I'll put in electronic billing, and it takes 4 to 6 months to get reoreimbursed.
You know, Massachusetts has an answer for that.
Hold on.
They're trying to pass 2 pieces of legislation in Massachusetts where Omnicare exists, okay, which was the impetus for
Don't get
Obamacare.
political.
They're trying to pass 2 pieces of legislation because doctors there, also like Illinois, have not been paid under Medicaid. So those 2 pieces of legislation state that if you're a licensed physician and you refuse to work for free anymore, we're going to pull your medical license.
This brave new world. Let's go here first, and then I'll go there. Yes, sir. Use that mic if you can. Turn it on.
It is on.
I can't hear a word you're saying.
That's
That doesn't
a bad
work.
mic.
You may have to shout out a little louder. What did he say?
What can I do to help out the community?
To help out the community?
Go work for the hospital, volunteer for the hospital. Just go to any local hospital, they need help, they need volunteers.
Great thing to do. Yes, sir.
Yeah, I got a question. This is the stuff that's flying under the radar. One of the largest cardiologist group as of January in the Northwest Burbs sold out to Lexington. Okay, you're not hearing this stuff. They didn't want to deal with the cardiologist group that I go to. Okay, and I blame actually, and I love what you've been doing, Joe, but I actually put a lot of it on the Republicans too, because they're not framing the debate against this guy, and this stuff is not being pointed out. And they don't want to deal with it. I played golf with one of the guys, and he says, I'm not working for that Joe anymore. We're going to sell out. We're going to take a payout.